Hello, my name is Nora Forst, and I'm a nursing student in the Bachelor's of Science of Nursing at Southwest Baptist University. Pursuing a bachelor's in nursing is not required on top of an associate's degree. According to the American Associates of the Colleagues of Nursing, the AACN, a higher degree in nursing education makes a major difference in clinical outcomes. Nurses with a BSN have better patient outcomes, including lower mortality rates and lower failure to rescue rates as well. This is why I wanted to continue my education, so that I could continue my understanding of the body and know when to make appropriate nursing diagnoses. I currently work in the ICU at Barnes in the Siteman Cancer Center. I was given the amazing opportunity right out of school, and I owe it to the patients to be the best nurse that I can be during the tough situations that they present to us with. The principles from my BSN or Bachelor's of Science in Nursing will be incorporated in my everyday care as well as learning. Each day, I am learning something new by asking questions and using evidence-based practice as well as research articles and also protocols to make the best nursing decisions and provide the best possible care for my patients. Throughout my bachelor's, I have learned how important it is to use chlorhexidine during baths, especially in the ICU, since most of my patients have an indwelling catheter and could easily obtain a catheter-associated bloodstream infection. My patients will always be bathed with chlorhexidine each day unless contraindicated. Not only have I improved on my research and understanding of the body, but also how to properly assess a patient in more detail. Health assessment is one course that went into great detail and broke down each part of the body to assess further than just a simple head-to-toe assessment. Learning never stops within the nursing practice. There are also online modules to complete and in-service meetings to attend. Although in-services are not always required, I think it is best to attend them to know what new information is out there and to learn about the new technology that could be used on my unit. I plan to continue my education further and get my master's degree in critical care within the next few years as well, so it is important to know about the new and improved information that is readily available to us. As a servant leader, people often need the exceptional care that nurses have the ability to provide for them. Sometimes patients need a helping hand, but they may have a certain religious view or would rather speak to someone anonymously. This is a good opportunity that I would take to include a pastor or affiliated religious member to support my patient. Otherwise, taking the time to sit and talk with my patient, or even just be in their presence, is something that I find extremely important as well. Mental health is just as important as physical health. Family members also play a huge role in healthcare when it comes to spirituality. I actually provided care to a patient this past week who was Muslim. I took caution to be as respectful as I could with her family, while still providing care to the terminally ill loved one. When the patient passed, it was even more important when I stepped in to ask the family members what specific measures were needed to be taken and what could or could not be done during post-mortem care. The family was very pleasant and very thankful for the way the other staff members and I had cared for their family. This type of care goes a long way with patients and their family members. I learned a great deal about working with peers throughout my BSN classes. I remember one project that was meant to get each of us to have an opinion and ultimately disagree, and then learn how to come to an effective conclusion to complete the project. This was not a joyful assignment, but no feelings were hurt, and we all learned how to work with one another and take each person's opinion and create one overall outcome. Personally, I have realized that it is very important to serve others, while also serving yourself. Nurses often become burnt out because they are working too much or taking their work home with them. When I leave work, I know that I need to leave the entire day, all the conflicts and all of the hard work there. When I go home, I take time for myself and allow myself to unwind and even allow myself to have self-relaxation, such as a massage or get my nails done every now and then. Holistic patient care is very important. It's important in creating a trusting nursing-patient relationship. When we provide holistic care, we are addressing all of the patient's needs and not just their medication orders or their primary diagnoses. In this type of care, we are allowing the patient to effectively communicate all of his or her needs in a caring and trusting environment. It is simple as a gesture, a smile, or asking how the patient is doing. This will open up a conversation and provide much more respect for you from the patient or their caretakers as well.